You've heard of tennis elbow, but the latest injury is swimmer's shoulder. We'll explain how this works. Is there a doctor in the house? Yes. Thank you. You picked a good time to come in here.
Great,
Dr. Murthi,
I know.
From Union Memorial, MedStar Union Memorial. He's in here. He's the head of the, of course, MedStar Union Memorial Hospital shoulder and elbow surgery. He's the chief. Rotator cuff.
No, you might have hurt yourself outside.
Yeah. Hey, you're in here talking about swimming, shoulder pains, and elbow pains.
Exactly.
Is that right?
Exactly.
When did this come about?
It's been known for many years. It's one of the most common things we see in our high-level athletes who do a lot of swimming, a lot of training.
Well, does it start with pain? I mean, of course it starts with pain, right?
The most common thing is pain. They come in, they're weak. They can't do overhead swimming anymore. They can't train anymore. And this is why they come in to see us.
Okay, what do you have right there?
Well, this is a typical shoulder model. This is a right shoulder. So when these people come in, these athletes come in, or even everyday swimmers, they'll usually commonly have problems along their rotator cuff.
Yeah.
And this is from overuse. They bring their arm overhead, 4,000, 5,000 cycles every training session. As you can see, when you bring that arm up, the shoulder, the rotator cuff here can get pinched, inflamed, and they get what's called bursitis or rotator cuff tendonitis.
How much swimming do you have to do to get to this point?
Even early training. You know, if you get out there and do a half hour of swimming, if you don't get flexible, do your stretching, you'll get swimmer's shoulder.
What kind? Show us an exercise, a stretching exercise.
The most common exercise we work on is having them lay on their side and work on stretching their arm down. So usually these athletes can't get their arm down past neutral. We want them to be able to get all the way down to the 90-degree position. Stretch out the back of their shoulder.
What's a recovery process in this?
Well, we have to shut them down for a while sometimes. It's going to take 4 to 6 weeks to recover from swimmer's shoulder.
Michael Phelps ever have this?
He doesn't, because you see that incredible flexibility he has. He does that flapping arm on the pool deck. He maintains his flexibility and strength, so he rarely gets swimmer's shoulder.
Same thing for a pitcher.
Same thing, exact same thing from a pitcher, volleyball players, tennis players.
It's this.
It's the overhead.
It's the overhead.
Exactly.
Everything should be underhand.
Maybe.
All right.
Maybe.
Hey, thank you very much.
You're welcome.
The
Thanks
chief
for having
is here
me.
with us explaining about, what do you call it, swimmer's
Shoulder, rotator cuff tendonitis.
Whoa, all right. Thank you. Thanks for coming in.
Thank you.
We'll be right back.